This week, more Medicaid drama in Minnesota as CMS announces a third funding freeze and Allina unveils its new patient and surgical center in Minneapolis. Welcome to the July 24th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. More Medicaid drama this week as federal officials announced they were freezing another $200 million in reimbursements to the state, saying efforts to battle fraud still haven't been enough. It's the third deferral of federal funding to the state this year, on top of a $259 million hold announced by Vice President J.D. Vance in February and $91 million announced by Dr. Mehmet Oz in May, for a total of $549 million just this year. The funding focuses on 14 services considered to be at what officials call high risk of fraud and doesn't involve traditional hospital care, although social services programs associated with some health systems have reported reimbursements have been cut off despite compliance with state and federal regulation. And some good news. This week, Allina officially cut the ribbon on the new Richard M. Scholl's Surgical and Critical Care Center at Abbott Northwestern Hospital.
3, 2, 1.
The $1 billion, 6-year, 10-story construction project wrapped up in June. It adds 190 patient rooms and 30 larger advanced operating rooms to Allina's South Minneapolis campus. Whitney Johnson is VP of Operations at Abbott Northwestern and told KSTP-TV that the building was built for 21st century high-tech medicine, but was also sensitive to the neighborhood that has hosted the hospital for more than 140 years.
We made a lot of thoughtful decisions and had a lot of conversation about design that would allow us to be good neighbors, including setting the bed tower back, recessed away from 10th Avenue, out of concern that if we did not, it would cast a shadow on Anderson Elementary's baseball field, which is right on the other side of the road there.
Patient care will start in the new facility in late August. And in St. Paul, the Minnesota Department of Health reported the state's 988 mental health support line has taken more than 370,000 calls, texts, and online chats in its first 4 years. MDH also said that incidents of suicide in the state has fallen and interactions have risen from 25,000 in the first 6 months of the program in 2022 to more than 85,000 in the first half of this year. And it was a big week in Washington for healthcare. Time is ticking down on the 119th Congress, with just days of formal sessions left before the midterm elections. Abby Mochtig has more.
The House Energy and Commerce Committee passed 2 healthcare price measures, including one that would require hospitals, radiology centers, and ambulatory surgical centers to post cash prices for a variety of procedures, listed by the Centers for Medicare and Medicaid reimbursement codes on an interior wall for patients to inspect. That's in addition to existing online requirements. It was one of 2 hospital price transparency measures that are moving through Congress this summer. The House Oversight Committee also advanced a new pharmacy benefit manager reform bill that would, among other things, ban PBMs from steering beneficiaries to their own affiliated pharmacies. The Senate Health Committee was also busy, approving a measure that would cap the cost of insulin for private insurers at $35 a month. That replicates the cap for Medicare Part D participants. The biggest headline this week, though, came from new rules unveiled at CMS that would pare back directed payment programs. The regulations codify the changes passed by Congress in the One Big Beautiful Bill. They include a phase down of the maximum permissible provider tax rate in Medicaid expansion states from 6% of net patient revenue to 3.5% by 2032. Minnesota's directed payment program is still awaiting a decision in Washington more than a year after an application was submitted. But if the new limits apply, it would substantially reduce the $1 billion in Medicaid matching funds that state officials hoped to get when the legislature approved the plan in 2025.
And that's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. Thanks for listening.